Why does this happen in pregnant women?
Now, this happens in approximately 5% of pregnancies, but we really do believe it's the hormonal changes. I mean, the hormones that pregnant women have just feed everything.
I almost said wreak havoc, but that's not nice.
That's
why your specialty is so involved. I mean, literally every part of the body can go a little haywire.
Everything grows.
Every system, whether it be ear, nose, and throat, or your
skin tags, whatever.
In cases of pregnancy, do you usually see them clear up?
We do. They typically clear up, but we do tell you come to the doctor, though.
Well, absolutely.
Yeah,
and people chimed in with bad medicine, right? I mean, they gave her all these ideas, and as we said, the big problem lies with misdiagnosis. I mean, it could have been a skin cancer. It could have been an infectious process that if you start messing with it, could spread and get worse.
And I tease that they're getting information from the street committee. That's my going joke when you're getting your information off the street.
And I don't care how big that street committee is. It doesn't trump one doctor who did the training and knows how to
create a differential diagnosis.
Well, that's exactly right. In view of the fact that STDs are at a all-time high, I think you have to consider that too.
Absolutely. There was a recent study that a doctor at UC San Diego looked at Reddit's STDs related posts over a 9-year period. And guess what? 58% of posts explicitly ask for a crowd diagnosis. So they wanted the people to tell them what to do.
And that's the worst scenario, that you want to get a diagnosis from somebody that's...
You don't want to miss a STD.
No, you don't. It's not just you.
Right.
It's everyone else that you're in contact with.
Absolutely.
I think that's such another important point.
Right. Go see your doctor.
All right.
Call us.
The internet can be helpful, but in many ways can also be dangerous. That's why the FDA just issued this alarming alert for all you parents out there. Take a look. These days, you can find just about anything on the internet. If you're looking for homemade alternatives to the things you use on a daily basis, a quick search can lead to hundreds of results. But recently, the FDA has issued a warning to parents about one do-it-yourself option: baby formula. According to the FDA, homemade infant formula could potentially lead to severe nutritional imbalances or foodborne illnesses, both of which can be life-threatening. This comes after reports of hospitalized infants that have been fed the DIY food. If you're a parent, you may be wondering, why is this so dangerous? And what are the best alternatives to keep your baby healthy? Jackie, I know this is right up your alley. Yes. You take care of both mom and baby. So what do you think about this?
I think this is not wise. We don't tell you we don't know what's in it. That's most important. And the reason the FDA has formulated the proper formula for babies is they know exactly what's in it. We don't want to create hypocalcemia or low calcium in a baby. And we want to make sure they're not getting infection and things that babies can't digest at that early age. I mean, their stomach is, as big as a little marble.
Right, and for the first year, babies should not be drinking any type of milk, right?
Right, especially raw milk. Yes.
And raw milk, what is raw milk? Well, it's milk that hasn't been pasteurized. There's a reason why we pasteurize milk. There's some pretty nasty critters that can live in unpasteurized milk. Some of the other ingredients that these online recipes are including are oils like olive oil and sunflower oil, gelatin, liquid children's vitamins, and, as you alluded to, raw milk, unpasteurized, can pass some very virulent bacteria.
And babies can't break that down. They can't process that.
No. And Dr. Jackie, how can mothers decide what is the right decision for them? Obviously, don't go to social media and TikTok.
Absolutely. Talk to your pediatrician. You know,
exactly.
Yeah, the American Academy of Pediatrics has given us all of the guidelines that we need. And, you know, they're mindful of cost because there are different types of baby food or baby formulas out there, whether it's dried baby formula, whether it's already mixed baby formula. But you have to find out what's best for you, but make sure you're talking to your pediatrician.
I mean, they do say breast is best.
Now, that is king.
Okay.
Yeah, liquid gold, we call it.
But not all women can breastfeed for one reason or another, so you have to know all of your options. But the point that we're making here is that don't let TikTok or any other social media dictate what you do.
A baby is so precious.
Right on.
And we don't want to jeopardize their health.
When it comes to questions about you or your baby's health, we want to stress you should not be going to TikTok for medical diagnoses. Go see your doctor.
Yes.
We just said it. You heard it.
Yes.
Stay right there. We'll be right back with Dr. Jackie. Coming up.
Why am I the mom of that kid? Our child was the bully. It felt like the rock bottom place of my parenting journey.
And later.
So I grip my two-seam fastball and I throw it down the middle. I saw the spin of the seam coming right back, try to move out of the way and hit it right off the side of the head. Right here in the chest. Once I arrived at the hospital, that's when stuff started getting real bad for me.
That's coming up. Coming on Monday, forget catfishing.
I don't know anything about that.
Could you be getting ear baited?
The push-out bra for men. Finally.
Then,
Why are black people facing comparison?
the podcasting duo taking on racism in America.
It was the first time that I was really thinking about what white privilege was.
Plus,
I just got released from the Cowboys. A part of my identity had been stripped from me.
how a simple tagline changed everything. That's on Monday.
When you have nausea, heartburn, indigestion, upset stomach, diarrhea, Pepto-Bismol coats and soothes your stomach for fast relief. And get the same fast relief in a delightful chew with Pepto-Bismol chews. Arm & Hammer Plus OxyClean with odor plasters. Stains are removed and odors eliminated. For a deep, powerful clean. More power to you. I brought in Ensure Max Protein with 30 grams of protein. Those who tried me felt more energy in just 2 weeks. Here, I'll take that.
Ensure Max Protein with 30 grams of protein, 1 gram of sugar, and nutrients to support immune health.
those rollers out that cabin. The auto roller era.
We can't make you leave your acne alone, but we can help get rid of the spots that your acne left behind. Different Dark Spot Correcting Serum has the maximum strength dark spot fading power you can get without a prescription. Do things different.
I broke my back. I had compression fractures in my T7 and T11 vertebrae. Jacoby and Myers brought us in and made us feel like we were part of their family. You always have somebody on your side with them.
Justice for you since 1972. Jacoby and Myers.
Burlington has so many ways to save you money this summer with dresses, cute shorts, brand name sandals, and swimsuits. It may be summer, but when it comes to incredible savings, it's just another day at Burlington. You'll love the deals. You'll love Burlington.
When you call Jacoby and Myers, our team goes to work on your case to get you the best legal and medical care so you can focus on what really matters. Nearly 50 years of personal injury experience. Justice for you since 1972. Jacoby and Myers. COVID-19 has changed how we show up and show out with our food. Now it's time to take the first step that lets us get back to talking smack with a side of mac and cheese. Before we can safely come together, we need the facts. As COVID-19 vaccines become available, you may have questions. Should I get it? Is it safe?
Should I wait?
It's smart to question. Now, get the facts at getvaccineanswers.org so you can make an informed decision when vaccines are available to you.
For a lot of parents, having a child who's being bullied can be a heartbreaking situation. But our next guest is a mom who found out her child was the bully. Take a look.
One day, it all fell apart. And I was like, why am I the mom of that kid? 4 years ago, my husband was dropping our 3 kids off at school, and the principal said, "This afternoon, I need to meet with you and your wife and your child." So the principal shares with us the very serious thing that our child had said that was very upsetting and traumatic to another child. I just felt all these emotions of thinking, how could you say something that could hurt another child so much that this other child didn't even want to come back to school and had panic attacks? Our child was the bully. Over the course of the next few days, we had so many conversations with our child. They were just angry and upset, saying things like, "I wish I had never been born." We started calling therapists and counselors, and they would say, "You need to go straight to the ER," because they're saying things that sound very suicidal. It felt like the rock bottom place of my parenting journey. At the hospital, they felt like it was safe enough for our child to go home, but they said immediately we needed to get our child into therapy. For the first few weeks of therapy, they were like, "This is ridiculous," but little bit by little bit, we did start to see these little glimpses that things were shifting. And over the course of a year, major change happened in our child's life. In the process, my husband and I really realized that we needed to go back to square one, and we needed to learn a completely new way to parent.
Please welcome the author of Love-Centered Parenting, Crystal Payne. Welcome to the show, Crystal.
I'm so excited to be here.
Such an important topic. Let's get right in it. As a parent, how do you feel knowing your child was bullying other kids?
There were so many emotions. I feel like there was fear and anger and shame and overwhelm and just that embarrassment and frustration.
How did your parenting change after you found out?
For me, it was when we started going to therapy. There was this just helplessness that I was feeling, and I said to the therapist, I said, "If there is anything that I can do to change, please let me know." And a few weeks into therapy, she actually called me into the office and she said, "I feel like you're trying so hard to fix your child. What would it look like to just walk with your child instead?" And that just hit me right between the eyes and really made me go back and examine the way I was parenting. I realized I was spending so much time correcting and very, very little time connecting with my kids.
And so how quickly did you see the change in your kids when you started changing the way you were parenting?
Well, at first, with lots of therapy and, time and just really working on myself, I was thinking, is this going to make any difference? But it did. And over the course of the next few months, and then at the end of the year, I looked back and my husband were like, "We don't even recognize our child anymore." But it wasn't just our child. It was also me. I felt so much calmer, and the tone of our home was just so much calmer as a result.
And I truly believe in therapy, and I think everybody should have one. And you talk a lot about that therapy that you guys were going through. How did the therapy help change your whole family?
The biggest thing was emotional language. We realized that a lot of times everything that we were feeling was just getting stuffed down and was coming out sideways as anger. And so when we learned to actually be able to say, "I feel sad about this," or "I feel embarrassed about this," or "I feel hurt by this," it changed everything because we didn't have to stuff it down anymore, and we could be honest and just really process through things.
And that's amazing. So how can other parents switch to a love-centered parenting like you guys have?
So instead of trying to fix or micromanage our kids, let's, number one, lean in and love. Let's approach our parenting from this posture of loving our kids. And instead of just trying to correct their behavior, let's connect with them. Let's get in on their level and love them instead of shutting down and shaming them. Number two, listen well, not only to the words that they say, but also to what are they trying to say with their actions, because actions sometimes speak louder than words. And number three, lead with humility. And that means as parents that we need to be honest and own when we've made mistakes and go back and apologize to our kids. And then finally, number four, let go. And this can be the hardest one as parents because we want to bubble wrap and overprotect and micromanage our kids. But ultimately, if we do that the rest of their life, we're just going to stifle them. And so we want them to slowly learn these things so that they can grow backbone and wings to really fly and succeed in the world.
A quick question I have, we talk about it's parents' responsibility to really monitor what's going on with their kids. Do you feel it's the parents' obligation to keep an eye on social media and cell phones and computers and things like that?
I don't think we should, look at every tiny little thing, but I do think it's important for parents to really educate themselves, because there is a lot of bullying that is happening with these anonymous apps that can be really dangerous. And so as parents, for us to be proactive in not only educating ourselves, but then also walking with our kids and talking with them about the dangers so that they understand.
Those are absolutely amazing tips to live by. I think I can use those personally.
Well, and bullying, unfortunately, is on the rise. It's just too easy to bully. Crystal, thanks so much for sharing and joining us today. We wish you and your family all the best.
Absolutely. Amazing.
Thank you so much.
Thank you. There's much more after the break. Coming up.
Mom, you take care of our entire family. How much are you going to be taking care of?
We're going to be there for you. You inspire me, and you inspire a lot of people.
Then,
so I grip my two-seam fastball, and I throw it down the middle. I feel the spin of the seam coming right back. Try to move out of the way, and hit it right off the side of the head. Right here in the temple. Once I arrived at the hospital, that's when stuff started getting real bad for me.
That's coming up. Coming on Monday,
Why are black people facing those tensions?
the podcasting duo taking on racism in America.
It was the first time that I was really thinking about what white privilege was.
That's on Monday.
It's something you probably got.
Depression makes it hard for me to follow through with my plans. My antidepressant helps, but there are times I still feel depressed and make excuses not to go out. Is it just me?
No. Many people taking antidepressants still have some symptoms. When taken with an antidepressant, Rexulti was proven to reduce depression symptoms an extra 62% compared to the antidepressant alone. So you can stay on your current treatment and help build on your progress.
Rexulti can cause serious side effects. Elderly dementia patients have increased risk of death or stroke. Antidepressants may increase suicidal thoughts and worsen depression in those under 25. Call your doctor about fever, stiff muscles, and confusion, which could be life-threatening, or uncontrollable muscle movements, which may be permanent. Increased cholesterol, weight gain, high blood sugar, decreased white blood cells, unusual urges, dizziness on standing, seizures, trouble swallowing may occur. When depression sets you back, keep moving forward. Make an appointment to talk to your doctor about adding Rexulti to your antidepressant.
My heart failure diagnosis changed my priorities. I want time for the people I love. My heart doesn't pump enough blood, so my doctor gave me Farxiga. It helps my heart do its job better. Farxiga helps keep me living life and out of the hospital for heart failure. Do not take if allergic to Farxiga. Symptoms of a serious allergic reaction include rash, swelling, difficulty breathing, or swallowing. Stop taking and seek medical help right away. Tell your doctor right away if you have red color in urine, or pain while you urinate, or a genital area infection, since a rare but serious genital infection may be life-threatening. Do not take Farxiga if you have severe kidney problems or are on dialysis. Other serious side effects include dehydration, sudden kidney problems, genital yeast and bacterial infections in women and men, urinary tract infections, and low blood sugar. Stop taking Farxiga and call your doctor right away if you have symptoms of ketoacidosis, which is serious and may lead to death.
More time with her? Sounds good to me.
If you can't afford your medication, AstraZeneca may be able to help.
I'm personal injury attorney James Bergener. Accidents can happen. If something happens to you or your family, call me. My firm and I will take you by the hand and guide you through everything. You see, personal injuries are just that. They're personal. You're not a number. You're more than just a name. This is your life. At my firm, each case is professionally and personally tailored to you. So if you've been injured, I've got your back. Call me now for a free consultation.
As parents, we make a lot of sacrifices for our children and ask for nothing in return. And our next guest is a mom we're shining some light on today for her incredible selflessness going beyond her own children. So please welcome Cindy to the show. Hi there, Cindy.
Thank you.
So, Cindy, you raised 3 kids on your own who are now adults, including one with autism. It's a tribute to your commitment and your love. And I wish your kids were here to tell you that, but they're actually the reason you're here. Check this out.
Hi, my name is Stephanie. I am Cindy's oldest child. My sister and I wanted to nominate my mom
To be recognized for her selflessness because she is a super mom who has raised myself, my older sister Stephanie, my younger brother TJ, and now my 10-year-old cousin Levi.
She's taking care of other people and leaving very little time, if any, for herself. My mom has always led by example. She has taught us to be patient and to be kind. I truly wouldn't be where I am today without learning those things from her.
Even when it's all too much to handle and she feels like giving up, my mom pushes through the hard times. She has spent her life dedicated to helping others without taking a second to care for herself.
Mom, you take care of our entire family.
Now it's your turn to be taken care of. To take time for yourself and to focus on improving your health.
You deserve it. Don't argue about it.
Love you, Mom.
Love you, Mom.
Love you, Mom.
Oh my goodness, how does that make you feel that your children want you to be recognized for everything that you do? Oh my God.
My children are wonderful. I am so proud of where they are in their life. And they're very honest. I don't take time for myself, but they're wonderful and they keep me going every day.
Well, Cindy, clearly you have done a wonderful job as a mother, because those kids are really a class act, and I think that's a tribute to you as a great mother and there for them along the way. That being said, that leads me to the next question. Do you ever get time just for yourself?
I get very little time to myself, but I get a lot of sleep at night. That's one thing I'm thankful for, is he sleeps, so I have a chance to breathe.
Now, you've taken on a lot with two special needs children that rely on you totally, and you want to continue to be there for them. So you've made a big decision recently. Now, can you tell us all about that?
Yes, I started a journey to lose weight. My health was declining. I had high blood pressure, stage 3 kidney. I have thyroid. I have a heart problem. And I was very obese. My starting weight was 298 pounds. And I decided to have the bariatric sleeve surgery. I recovered well. I haven't had any major medical issues.
Well, I think your decision to lose weight, you were at a point where really you were putting your health in severe jeopardy. So tell us, how much weight have you lost so far?
I've lost 64 pounds. I feel much healthier. I have a lot of excess fat that I want to get off, but I had to do this journey. I needed to do it for my family, and especially TJ and Levi, because they need me to be there for them.
Well, Cindy, we're so very proud of you. And, taking that first step, just committing yourself, hey, I'm going to take care of myself, I'm going to lose the weight, was huge for you. But we're not done yet. I'd like to introduce the host of the podcast, Wellness Inc. with Dr. Mike, and weight loss expert, Dr. Michael Moreno, who's helped millions of people lose weight. He's our friend, our colleague. He has something he wants to tell you. Hi there, Dr. Mike.
Well, hello, everybody. And first of all, a little piece of information I like to share with patients. Number one is that, and I tell my patients this all the time, sometimes we have to be a little bit selfish in order to be giving. And we always tend to think of that word selfish as bad, but if we don't take care of ourselves, we can't be there for our loved ones, for our significant others, for our kids. So I'll tell you one thing that I use a lot with my patients. I call it the M&M tool, and it stands for mindfulness and motivation. And what it basically is think about everything you're going to do before you do it. We live this fast-paced life. We're constantly just making decisions without even thinking about it. So stop for a second and think about the decisions you make, about what you're going to eat, or about the food you're going to order at a restaurant, or perhaps what you're going to cook for dinner, maybe about exercising. But take 5 seconds and think about, what is the decision I'm about to make, and why do I want to be healthy? Why do I want to make the right choice? It's a different answer for all of us. Whatever it may be, give yourself an extra 5 seconds before you make a decision about what you're going to do. It will really help you and begin to make right decisions easily on your own without even thinking more about it.
And Mike, you have something you want to tell Cindy, right?
Well, listen, for many, many years now, my group and I have made it an effort and made it our goal to provide support, ongoing 24/7 support to people all over the country, all over the world. We have a very, very active way to support people. It's a safe place. It's a place to go when you need that extra help, when you're about to make decisions that you know may not be the best. We're going to be there for you, and I'm going to offer you to join our group and be a part of our journey because we want to be a part of your journey. You inspire me, and you inspire a lot of people.
Why, thank you so much.
We think you need to take a little time to yourself. So we reached out to the Intercontinental Cleveland Hotel, who would like to give you a luxurious one-night stay and dinner for two. Now, we also reached out to Sitter City, who want to give you a free one-year membership with $500 credit to help you find a special needs sitter
I need all that.
to take care of your great nephew
Take my kids
while you
with
take that well-deserved night off. How does all this sound?
Oh, that sounds amazing.
Cindy, best of luck to you. Thanks so much for joining us and being the person that you are. Dr. Mike, thanks for giving all your great advice.
Thank you. I'm just honored to be a part of something like this.
Yeah.
Thank you.
Cindy, you deserve it.
Not even one.
Thank you so much.
All right, don't go anywhere. We'll be right back.
Coming up.
So I grip my two-seat fastball.
Yes.
And I throw it down the middle.
Yes, you
Spin
do.
of the seat coming right back. Try to move out of the way and hit it right off the side of the head. Right here in the chest. Once I arrived at the hospital, that's when stuff started getting real bad for me.
Then I felt healthy and I didn't want to do it because I was apprehensive about having a colonoscopy. After a confirmatory colonoscopy, I was diagnosed with colorectal cancer.
That's coming up. Closed caption provided by...
Ready to blow away the rules of volume? New Air Volume Mega Mascara by L'Oreal Paris. For mega volume, yet mega light. A whipped formula and a cushiony brush. New Air Volume Mega Mascara by L'Oreal Paris. You're worth it.
Odor is hard-earned. Eliminating it is easy with OxyClean Odor Blasters. Work your magic.
If you're a Medicare beneficiary and live in the area, call now to see how this little card could get you some big benefits, including money added back to your Social Security check. With one toll-free call, you can find out how easy it is to get all of your original Medicare coverage, plus extra benefits. You get an all-in-one plan designed to fit your needs so you can be your best every day. You could have medical coverage, prescription drugs with $0 generics, dental, vision and hearing, plus the WellCare Visa Flex Card, money for over-the-counter items, and money back in your Social Security check each month, and so much more. And here's more good news. You can get this WellCare plan for a $0 monthly premium. How can WellCare offer all of those benefits for a $0 monthly premium? It's simple. Medicare Advantage and Medicare Part D prescription drug coverage are important parts of Medicare. WellCare has a contract with Medicare to offer and provide these important options to you. Call right now to get your free copy of the WellCare All-in-One Guide. Call 1-877-264-0056 now. There is absolutely no obligation for requesting this free information. WellCare offers benefits that go beyond the basics, including up to $1,500 each year added to your Social Security check to help cover your Part B premium. Call today to get your free copy of the All-in-One Guide with absolutely no obligation. Your free plan guide will give you the details you need to make a smart choice for your Medicare coverage. Just call 1-877-264-0056. Remember, there's no obligation for requesting this free information, so call 1-877-264-0056. WellCare, Beyond healthcare, a better you.
If you want to sell your house fast, Bye Bye House will immediately pay cash for your home. Any house, any condition. Bye Bye House takes the time, stress, and inconvenience out of selling a home. There's no obligation. You look at the house and make a cash offer on the spot. Plus, there are no agents or open houses, no fees or commissions, and no inspection repairs needed. Even the problem properties are no problem for Bye Bye House. Call or visit us online at buybuyhouse.com.
Our next guest was an aspiring Major League Baseball player with a bright future ahead of him, and within seconds, he was brought to the brink of death. Take a look.
So I grip my two-seam fastball, and I throw it down the middle. So the spin of the seam coming right back. Try to move out of the way and hit right off the side of the head. Right here in the center. I grew up in La Mirada, California. Football and baseball were my two dominant sports in high school. I went to 4 different colleges, and I eventually signed with the St. Louis Cardinals my senior year. The next 3 years, I was grinding through the minor leagues. By 2017, I was in AAA. I was pitching well that season. May 9, 2017 is a day that will never be forgotten in my life. We were playing the Iowa Cubs. The second inning of the game, I grip my two-seam fastball and I throw it down the middle. He hit it right back where it came from, and it came right back. Took it right off the side of the head. I was knocked out for a good 5 to 10 seconds. Once I arrived at the hospital, that's when stuff started getting real bad for me. The memories start fading a bit. One of my last memories is them shaving my head. And I think the time when I finally came all the way to it and had a conversation with my dad, who informed me, like, hey, you had surgery on your head. And I looked at him like, what? When did that happen? And he did explain to me that they had to remove my skull and stop the bleeding. So once that died down a bit, they were able to put my skull back on, stitch me back up. It took about 2.5 weeks to get out of ICU, and then once I got out of that, they removed my drains from my head, and from that point on, they put me through a barrage of tests, still in the hospital, to see if I could walk, eat, think again. And it took 3 weeks to finally leave the hospital. I was spending the next few months doing pretty much nothing besides walking and eating. And 3 months to the date, on August 9th, I got my last MRI, which showed that I had no more brain shift and I was cleared for baseball activity. The next season pursued, and I had put together a pretty good season. So on July 23rd, 2018, I made my MLB debut.
I'd like to welcome Major League Baseball pitcher and author of One Line Drive, Daniel Ponce de Leon, to our show. Welcome, Daniel. Truly an honor.
All right, thank you guys for having me on here.
Well, you're a fighter and a survivor.
Yes, Daniel.
We are so sorry you had to go through such a horrible ordeal. You know, my son is a neurosurgeon. You know, he tells me about these cases, traumatic brain injuries. Typically, you get hit like that, you cause an intracranial bleed. The only way to deal with it is to remove part of the skull, stop the bleeding, and, keep your fingers crossed that you get back to life as well as you have. So we know how much you love baseball. What's it feel like to finally go back to baseball after such a devastating injury?
Well, at first, I had people, anytime anyone came to hug me or touch me, they would treat me like I was a fragile piece of glass. They would hug me so softly. And then once I was able to step on the mound and pitch and face hitters, you could see the doubts fade. And, once I was able to pitch during the season, that's when pretty much I was able to cancel all doubts until, even my Major League debut, where I was able to go no-hit 7 innings.
Now, Daniel, after you've gone through such an injury like that, how did you get past that point, or when did you get past the point that you didn't think about it?
Well, right away in the hospital, once I was able to walk and talk and do all the things, I felt normal, and I knew I was okay. I just needed to heal. I'm a faithful man, so I was able to rely on my faith to help build up strength to get back out there as well.
And Daniel, during the course of this injury, your comeback, did it affect you in any way personally? your personality, attitude towards others?
Yes. After that point, I made a 180 in my life. I was a new father at the time. I had a girlfriend, but it was unmarried, so me and her felt we were hypocritical in our own faith. So we started doing things right, living separately, and then we also, I didn't even know how to really love properly. Our love languages were different, and I really had to learn how to be a good father, good husband, and learn how to love, really.
So after this, what is it you want people to take away most from your story?
Well, from the story, I was unintended that there's different storylines in there, relationship-wise, fatherly-wise, and faith-wise. And the real reason why I wrote this book was the outreach from the fans and people who know me. They reached out and told me how they felt from my story. So, it took a little bit of convincing, but I ended up writing this just so we could help change lives and give hope to others, and especially those who believe in faith in a God. Then here we are,
And I always say pain has a purpose, and you certainly have turned this whole incident into a purpose where you can help other people get over their fears.
Yeah, I hope so. That's one of the main reasons why we're doing this is, help others.
Well, Daniel, thanks so much for coming on the show and sharing your story today. We'll be watching and rooting for you, my friend, no doubt.
Thank you. Thank you guys for having me on here.
Our pleasure. We'll be back right after the break.
Coming up, I felt healthy and I didn't want to do it because I was apprehensive about having a colonoscopy. After a confirmatory colonoscopy, I was diagnosed with colorectal cancer. Then
When we pivoted into the COVID-19 services, there are 5 things that I learned along the way.
That's in today's Pivot 12 file. That's coming up. Closed caption provided by...
Life doesn't stop for diabetes. Be ready for every moment with Glucerna. It's the #1 doctor-recommended brand that's scientifically designed to help manage your blood sugar. Live every moment. Glucerna.
This is Steve. He used to have gum problems. Now, he uses TheraBreath Healthy Gums Oral Rinse with clinically proven ingredients, and his gum problems have vanished. TheraBreath. It's a better mouthwash at Walmart, Target, and other fine stores.
Angel Soft with fresh lavender scent. The scent is in the tube. No, it's in the tube. Nope. The fresh lavender scent is in the tube. There you go.
This is the Dyson Corral Straightener with manganese copper alloy plates. Invented to flex, shape, and gather for enhanced styling. With half the hair damage, and even without a cool